Good morning, wherever you are. This is Amara Saul from ConferenceHype. Our segment will focus on systematic review of immunosuppression after chimeric antigen receptor T-cell therapy for post-transplant lymphoproliferative disorder. From the 2026 May edition of Kidney International Reports. Background, Introduction. The use of chimeric antigen receptor T-cell therapy for relapsed or refractory post-transplant lymphoproliferative disorder in solid organ transplant recipients is a rapidly evolving frontier in immunotherapy and transplantation. Methods. To address this gap, we conducted a systematic review of published data pertaining to CAR T-cell therapy and PTLD after solid organ transplantation. Results. Our findings reveal substantial variability in immunosuppressive management before and after CAR T-cell infusion, including the withholding of immunosuppression, or the use of single-agent or combinations of corticosteroids, calcineurin inhibitors, antimetabolites, or mammalian target of rapamycin inhibitors. Discussion. Our review underscores the necessity of an individualized approach to these patients that accounts for factors such as CAR T-cell persistence and prolonged B-cell depletion, and highlights the need for further research on this clinical scenario. From the 2026 APRA 28 edition of Neurology. Background. Previous studies, including large cohort analyses comparing vaccinated and unvaccinated adults, suggest that routine immunizations such as inactivated influenza vaccines may reduce Alzheimer dementia risk. Methods. This retrospective cohort study analyzed data spanning 2014-2019 from IQVIA PHAR Metrics Plus for Academics, a U.S. healthcare claims database. Results. The HIV group included 120,775 unique participants, and the SIV group included 44,022 participants. Discussion. High-dose influenza vaccination is associated with reduced AD risk compared with standard-dose vaccination in adults greater or equal to 65 years, with a stronger effect among women. From the 2026 May edition of Kidney International Reports. Background, Introduction. Although fatty liver disease is a known risk factor for chronic kidney disease, its association with kidney failure remains unclear, especially after its redefinition as metabolic dysfunction-associated steatotic liver disease. Methods. We used 187,881 individuals with CKD from medical screening data of the National Health Insurance Service database of Korea. Results. The study population had mean age of 63.3 years, with 58% females. Discussion. In this large-scale observational study, MASLD was associated with kidney failure in individuals with CKD. From the 2026 May edition of Nature Medicine. Prioritizing artificial intelligence-detected imaging findings may reduce the time to diagnosis of lung cancer. This prospective, multicenter, randomized controlled trial tested whether immediate AI prioritization of primary care-requested chest X-rays influenced time to computed tomography and lung cancer diagnosis, the primary outcomes. Secondary outcomes included the number of urgent suspected lung cancer referrals, incidence and stage of lung cancer, times to urgent referral and treatment, concordance between AI and radiology reports, and algorithm accuracy. AI was available in both study arms, with AI prioritization randomized by day. 97,731 participant CXRs, 4,405 were excluded due to data compliance issues or failure of randomization, resulting in 93,326 CXRs analyzed. A total of 13,347 CTs were identified, with 2,766 performed within 14 days of CXR.
This is ConferenceHype. Stay with us, coverage continues.
From the 2026 May edition of Nature Medicine. Homologous recombination deficiency arising from BRCA1 or BRCA2 or PALB2 mutations confers sensitivity to platinum chemotherapy and PARP inhibition in pancreatic cancer, and may enable prolonged disease control with immune checkpoint blockade. The Phase 2 POLAR trial evaluated maintenance Pembrolizumab plus olaparib following platinum-based chemotherapy in biomarker-stratified metastatic PC. 63 participants were enrolled into 3 cohorts, Cohort A, Cohort B, and Cohort C. Cohort A used a 2-stage design with co-primary endpoints of at least 43% response evaluation criteria in solid tumors objective response rate and at least 77% 6-month progression-free survival rate. From the 2026 May edition of British Journal of Cancer. Background: germline genomic sequencing is increasingly offered to children with cancer. Methods: using a convergent parallel mixed methods design, parents and children completed questionnaires at baseline post-consent, results return, and for parents, 1 year post-enrollment. Results: 187 248 parents and 1932 children from 128 144 families participated. 49 parents were interviewed. Discussion: consent for trio GGS at cancer diagnosis is complex, requiring flexible, tailored processes. From the 2026 APRA 28 edition of Neurology. Background: women's health advice in people living with idiopathic intracranial hypertension is inconsistent, primarily due to an enduring concern that hormonal contraception, including oral contraceptive pills and hormonal intrauterine devices, might be associated with a higher prevalence of IIH. Methods: systematic searches of Ovid Medline, EMBUS, and the Cochrane Library were conducted from their inception to May 14, 2025. Results: a total of 13 studies were included. Discussion: the meta-analysis found no significant association between HC use and IIH prevalence, with consistent results across various HC modalities. From the 2026 APRA 28 edition of Neurology. Background: the optimal target blood pressure during and after mechanical thrombectomy for acute ischemic stroke remains uncertain. Methods: retrospective observational study analyzing data from 2 tertiary stroke centers, gathered between October 2020 and September 2022 within the German Stroke Registry Endovascular Treatment, a national prospective registry of patients receiving MT for ischemic stroke. Results: among 300 patients analyzed, 123 patients had at least 1 drop, including 77 patients with 1 drop and 46 patients with 2 or more drops. Discussion: BP drops within 24 hours after successful MT are associated with worse functional outcome. This is ConferenceHype. Stay with us, coverage continues. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 May edition of Journal of Minimally Invasive Gynecology. Background: without standardized guidelines, the management of thoracic endometriosis syndrome continues to fuel debate. Methods: previous reviews have reported poor outcomes but lack data on complications, hospital length of stay, and chest tube drainage. Results: 28 studies including 1182 patients met our eligibility criteria. Discussion. Our findings reveal a clinically meaningful burden of post-surgical pneumothorax recurrence, reoperation, and complications among TES patients. From the 2026 May edition of Journal of Minimally Invasive Gynecology. Background. To evaluate the association between the endometriosis staging and the type and intensity of pain reported by patients, describing the pain intensity across different pain types. Methods. Data sources. On January 27, 2025, a systematic search was conducted in PubMed, Scopus, Web of Science, EMBASE, and the Cochrane Library. Results. 2 reviewers extracted data independently, with a third verifying results. Discussion. Dysmenorrhea is linked to higher pain intensity in women with endometriosis, while dysuria is linked to lower intensity. From the 2026 May edition of British Journal of Cancer. Background. Patients with locally advanced breast cancer undergo staging tests. Methods. A prospective cohort study in patients with ILBC and TNM stage 3 or IB was conducted contemporaneously to the RCT. Results. Between December 2016 and April 2022, 41 patients with ILBC were enrolled, 38 undergoing all 3 imaging tests. Discussion. In this cohort, 18 FFDG PET-CT detected all cases of metastatic spread. From the 2026 May edition of British Journal of Cancer. Evidence from conventional and Mendelian randomization epidemiological studies support the conclusion that obesity is causally associated with increased risk of several common cancer types. Some evidence, notably from quasi-experimental bariatric surgery studies, support the concept that sustained long-term weight loss in individuals is associated with reduction of cancer incidence, particularly in women. Yet, there are no authoritative public health policies directed specifically at large-scale weight management interventions to prevent obesity-related cancers. At least 2 adversities conspire against public health success: awareness of the causal link between obesity and cancer risk, and lifestyle interventions are associated with only moderate weight loss that is generally not sustained long enough to result in clinically meaningful cancer prevention.
This is ConferenceHype. Stay with us, coverage continues.
includes the ConferenceHype weekend roundup of the top medical journal articles of the week. Which study could change practice, and which paper should we revisit in greater depth? If we missed an important article, tag on X and join the discussion. Share this roundup with a colleague or your clinical team, add your perspective in the comments, like the video, and subscribe with notifications turned on for next week's journal coverage.